Today I wanted to talk about giving Narcan for opioid overdose or suspected narcotic overdose. In this video, I wanted to cover 10 topics. What is Narcan and how does it work? How can I recognize an opioid overdose? When should I give Narcan? How do I give Narcan correctly? How long does Narcan take to work? And how long does it last? What should I do after giving Narcan? Can Narcan hurt somebody who isn't on opioids? What if the person wakes up angry or confused after Narcan administration? And can I give Narcan more than once? We'll cover those topics coming right up. So what is Narcan and how does it work? Narcan is a medication that competes for the same receptor sites that the opioids are using. So it effectively blocks all the effects of the overdose and within minutes. It's not addictive and it only works on opioids. So basically it comes in and takes over the receptor sites and no longer allows the opioids to attach and create their effects. Typical signs and symptoms of the opioid overdose are going to be slow respirations, pinpoint pupils, cold, clammy skin, unresponsiveness, maybe some gray lips or fingernails, and slow pulse. As far as when to give a Narcan, you want to give it immediately as soon as you suspect the overdose. So, check the pulse, check the breathing, double check the pupils, see if you have a flashlight with you or a phone light, see if they're reactive to light. Obviously, if they're pinpoint, they won't be. But you can just establish that. If you see that and somebody's not responding to you, go ahead and give the Narcan. It's not going to be a problem for somebody who hasn't taken narcotics. It only blocks opioids at the receptor site. So you can go ahead and give it if you need to. You can also give it again a couple times. I've given the Narcan and, people they wake up like seconds after you give it. And they're a little disoriented. They'll be asking questions. They'll just be staring at you like, what the hell happened? I was in dreamland for a minute. And then you're pulling them out of that. So they can be a little angry because if they're used to having that medication, be pretty upset that you killed their buzz. But also you saved their life, so there's that. You can give it again in, I know I've seen it in the literature 2 or 3 minutes. God, that's really fast. I usually give it when they start, going out again. If it looks like they're starting to lose consciousness and their eyes roll back in their heads and they're, not with it, yeah, give another dose if you have it. But I would wait until then because you don't want to blow an opportunity to give the Narcan twice as needed. If you give it one right after the other, chances are they're going to compete and then they'll both be toast. So you want to just hold off until they actually need it, and it's no problem. You'll see when it's necessary to do that. Like I said, as long as it works, it can work for 30 to 90 minutes. It depends on what their tolerance level is. So everybody's different, but like I said, wait for the symptoms to come back if you don't have emergency medical help there yet, or you're getting them to the hospital and you got a bit of a drive, go ahead and give another dose in 30 minutes or so, or when symptoms return, okay? And after you give the Narcan, just monitor. That's it. There's nothing else to do. Just keep them calm, just say sorry. But your pressure was down, your pulse was down, you weren't responding, your skin was clammy, your lips turned blue, you were in trouble, and going to get you to medical attention and get this squared away. All right, so that's it. I hope you guys enjoy and take care. Talk to you later.